Welcome to this training video on how to use Parafricta bootees. All these products are intended to aid in the prevention and healing of pressure ulcers, either alone or in combination with pressure relieving products. They can also be worn over wound dressings. There are 3 different models of bootie. There are 2 reusable and 1 single patient use version. My colleague will describe whilst I demonstrate.
This is the reusable slip-on version, which is the most widely used. There is also the adjustable bootie like this. The adjustable bootie is best used on patients with swollen ankles or requiring protection higher up the leg over the ankle bone. The third type is for single patient use, which is in the easy-on style.
It's important to remember that pressure ulcers, sometimes called pressure injuries, more commonly called bed sores, can lead to very serious, even life-threatening health consequences if left untreated. If you or anybody in your care has a pressure ulcer, we strongly advise that you speak to a qualified healthcare professional.
The bootees of all styles are designed for wear in bed and may also be used whilst the patient is seated in the chair. The grip sole will assist in safe transfer from bed to chair. Their aim is primarily to protect the heels, but will protect other parts of the foot which are at risk of pressure ulcers, such as the side of the foot or the ankle bone. Having chosen which style of bootie to use, the next step is to choose the correct size for your patient. You can do that by measuring the length of the foot from the heel to the toe, and then consulting the size selection tables which you will find in our user guides and online. If in any doubt about which of 2 sizes to use, always select the larger option. In the case of the easy-on single patient use bootie, there's an extra measurement you need to take. So as well as taking the length from heel to toe, it's important to measure the patient's ankle circumference. If the ankle dimension exceeds that recommended for the length of the bootie, then you should either use the next size up or switch to the looser fitting adjustable bootie. When using the adjustable style bootie, firstly, release all the straps. That will make it very easy to slip the patient's foot into the bootie. You can then secure the bootie with the hook and loop straps. The adjustable bootie should be used rather than the slip-on bootie if the patient's ankle bone is affected, as the protective fabric extends further up the leg. In all cases, it's important that the skin of the foot is in contact with the low-friction lining of the bootie. A patient should not be wearing their socks underneath these or anything that comes between the skin and the low-friction fabric. Except, of course, if either anti-embolic or compression hosiery is prescribed by a medical professional to be worn inside the bootees. In all cases, as well as preventing and being used to treat pressure ulcers, the bootees may simply be used to help retain wound dressings, which tend to get rucked up and displaced by the action of friction and shear. If a bootie becomes soiled, or clinical judgment is that they are no longer clean enough to wear, the reusable bootie should be washed and replaced, and the single patient use bootees should be discarded and replaced.
There are 2 important precautions to highlight. One is that Parafricta bootees should never be worn directly over an undressed open wound or open pressure ulcer. They are suitable for wearing over a dressed wound. A further precaution is that whilst bootees are ideal for Category 1 pressure ulcers, which are characterised by non-blanching erythema and other changes in skin condition, they should never be worn alone when there is a suspected deep tissue injury. Most healthcare professionals will recall that a deep tissue injury will present with a deep purple colour and other changes to the appearance of the skin on the heel. It's a condition which should only be treated by offloading the pressure from the heel according to the guidelines.
The way that Parafricta works is by providing relief from friction and the shear associated with it. If you would like to understand more about how the bootees work, please look at the video on our website. The ideal time to use the bootees is preventatively in situations where the heel and foot is exposed to high levels of friction and associated shear, and before the skin begins to break down completely. For example, any patients who frequently use their heels to push themselves up the bed, or any condition where a patient will be restless or will exhibit any form of chronic repetitive movements. There are other conditions where the skin is likely to be very vulnerable. For example, in diabetics or people with very fragile skin or at the end of life. Whilst prevention is ideal, the bootees can be used on Category 1 pressure ulcers, and they can be used when advised by a healthcare professional on Category 2 pressure ulcers which have been dressed. We advise elevation or offloading if possible for any Category 3 or Category 4 pressure ulcer or suspected deep tissue injury. But it may well be that in some cases that is very difficult to manage the patient using immobilization, elevation and offloading. Healthcare professionals may judge that it is necessary to use a combination, for example, or pillow and wedge with Parafricta bootie to provide the maximum possible level of relief to the affected area. The slip-on and adjustable bootees can be washed ideally in a light load at 60 degrees on a synthetic setting in a domestic washing machine. Hospital laundries and commercial laundries often have a special setting called sanitizing cycle, which will go up to 70 degrees for up to 10 minutes. They're fine with that, and they can be tumble-dried on a low-temperature synthetic cycle. Or at home, patients will very often air-dry the bootees. Sometimes the bootees may be soiled for whatever reason, and this time there's any soil which is just not removed by normal detergent. Then proprietary oxidizing stain remover will help to remove those stains. You can even pre-soak them in those, but never use domestic or chlorine-based bleaching agents. The bootees should not be ironed or dry cleaned. The easy-on, single patient use bootees cannot be washed and reused, but light soiling can be removed with a moist, sanitizing wipe.
In summary, 1. Remember that pressure ulcers are a serious condition and should always be addressed by a healthcare professional. 2. Consider the most suitable style of bootie for your patient. 3. Measure the length of the patient's foot from heel to toe. With the Easy-On bootie, also measure ankle circumference. Choose the most suitable size of bootie. 4. Never place the bootees directly over an open ulcer or wound. 5. Change or replace the bootees when they become soiled. 6. For reusable bootees, follow the washing instructions on the care label and IFU.
Parafricta reusable bootees can be prescribed on an FP10 form under Part I-XA of the drug tariff for England and Wales. They are also listed on the equivalent parts of the Scottish and Northern Irish drug tariffs. If you need more information, please check out our website parafricta.com. You can email us at info@parafricta.com or call 01-869226-566. Other information on how to use the bootees is in our user guides, which are available online.